Hello everyone, welcome to Pediatrics. This video is about growth deficiency in children. Growth deficiency, which is formally termed failure to thrive, is a deceleration of the growth velocity resulting in crossing two major percentile lines on the growth chart. The diagnosis is also made if a child younger than age 6 months has not grown for 2 consecutive months, or if a child older than age 6 months has not grown for 3 consecutive months. Now, there are 3 general patterns of the growth deficiency. These patterns suggest but are not specific for the different causes. So, in type 1 growth deficiency, the head circumference is preserved and the weight is depressed more than the height. This most common type results from inadequate caloric intake, excessive loss of calories, or inability to use calories peripherally. Most such cases result from inadequate delivery of the calories. This may be the result of poverty, lack of caregiver understanding, poor caregiver and child interaction, abnormal feeding patterns, or a combination of factors. Second is type 2 growth deficiency. This is associated with genetically determined short stature, endocrinopathies, constitutional growth delay, heart or renal diseases, or various forms of skeletal dysplasia. Now, type 2 growth deficiency is characterized by normal head circumference and proportionate decrease in the height and weight. Now, third type is type 3 growth deficiency. In this type, all 3 parameters of growth, that is head circumference, weight and height, are lower than normal. This pattern is associated with central nervous system abnormalities, chromosomal defects, or in utero or perinatal insults. Now, the clinical findings. In the initial evaluation, the history and the physical examination will identify the cause of growth reduction in the vast majority of cases. Now, these are the components of initial evaluation. First is the birth history. Ask for the newborn screening result. Rule out intrauterine growth retardation, any history of anoxia or congenital infections. Then is the feeding and nutritional history. Ask about difficult sucking, chewing, swallowing, and also ask feeding patterns, intake of formula, milk, juice or solids. Then is the stooling and voiding of urine. Ask about diarrhea, constipation, vomiting or poor urinary stream. Then is the growth pattern. Several points on the growth chart should be evaluated. Other components of the initial evaluation include recurrent infections, previous hospitalizations, HIV risk factors, detailed developmental history. Social and family factors include family composition, financial status, sports, stresses, heritable diseases, and height and weight of the relatives. And finally, detailed review of the systems. Now, the physical examination should focus on the signs of organic disease or evidence of abuse or neglect. Specifically, any dysmorphic features, skin lesions, neck masses, breath sounds, heart murmurs, abdominal masses, and neuromuscular tone and strength. Now, throughout the evaluation, the physician should observe the caregiver and child interaction and the level of family functioning. Now, developmental screening and laboratory screening test, including complete blood count, blood urea nitrogen, creatinine, electrolytes, urinalysis, and urine culture, complete the initial evaluation. Now, next step is further evaluation. A prospective 3-day diet record should be standard part of the evaluation. This is useful in assessing undernutrition even when organic disease is present. The diet history is evaluated by a pediatric dietitian for calories, proteins, and micronutrients, as well as for the pattern of eating. Now, additional laboratory tests should be ordered based on the history and physical examination. For example, stool collection for fat determination is indicated if a history of diarrhea suggests malabsorption. And moderate or high amounts of proteinuria should prompt workup for the nephrotic syndrome. Next, vomiting should suggest a gastrointestinal, metabolic, neurological, infectious, or renal cause. Now, the tempo of this evaluation should be based on the severity of symptoms and the magnitude of growth failure. Now, the treatment of the growth deficiency in children. A successful treatment plan addresses the child diet and eating problems, the child's development, caregiver skills, and any organic disease. Now, high caloric diet and frequent monitoring, that is every 1 or 2 weeks initially, are essential. Now, this table shows acceptable weight gain by age in children. From birth to 3 months, it should be 20 to 30 grams weight gain per day. Then 3 to 6 months, it is 15 to 20. From 6 to 9 months, it is 10 to 15. From 9 to 12 months, it is 6 to 11. From 12 to 18 months, it is 5 to 8. And in children from 18 to 24 months, it is 3 to 7 gram weight gain per day. Now, the child with growth deficiency may also be developmentally delayed because of living in an environment that fails to promote development, or from the effects on the brain of nutrient deprivation. Now, it is important to remember that restoring nutrition does not fully reverse the deficit, but does reduce the long-term consequences. Now, education in nutrition, child development, and behavior management, as well as psychosocial support of the primary caregiver, is very essential. If a family dysfunction is mild, behavior modification and counseling will be useful. Daycare may benefit the child by providing a structured environment for all activities, including eating. If family dysfunction is severe, the local department of the social services can help provide structure and assistance to the family. Rarely, the child may need to be temporarily or permanently removed from the home. So, hospitalization is reserved for the management of dehydration, for cases in which home therapy has failed to result in the expected growth, for children who show evidence of abuse or willful neglect, for the management of an illness that compromises a child's ability to eat, or for care pending foster home placement. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.